suctioning. I'm not going to document just yet because I'm going to use my gloves from the last procedure. And now I'm going to clean the trach. I have him in semi-Fowlers. I'm looking at his oxygen. It looks good. I have him on 100%. His vitals look good too. And I have provided him with a pad of paper and pencil so he can write whatever he needs. And then also, if he needs me to stop the procedure, I've asked him to raise his hand. So right now we're going to start the cleaning. I'm going to remove his oxygen, take out the gauze under the trach, and I'm going to dispose of it with my gloves. I have my clean and care tray. The expiration is good. So since it landed outside of the 1-inch border, I'm going to get new swabs that I have right here that I brought with me. So I'm going to remove the old swab, and I'm going to open up my new swabs and place them on the sterile field. Okay. I have my water here, my sterile water. Check the expiration date. I checked the label 3 times. It's good. I have the label up. Pouring my water. Now I put on my sterile gloves.
Ready? Make it. Take up one side. Make this. Yeah.
Now I get both my hands are sterile still, so I'm going to put my hydrogen peroxide. That in. It's half hydrogen peroxide and half sterile water. Link if you're doing okay. Great. I'm going to look at his oxygen levels, and they look good. This is going to be my non-sterile hand now. Put that in the hydrogen peroxide. Let that soak a little bit. Take my sterile hand and clean it. Clean inside to get the secretions out. Clean the outside. Make sure that it's clean. Okay. Drop it in the sterile saline rinse. Rinse it really well to get all the hydrogen peroxide out. 9 o'clock to 6 o'clock. Put that on. Now I'm going to clean the area of the stoma. Sterile hand, sterile saline. I can touch the top of the trachea too. To make sure that it's stable so it doesn't damage the tissue, I do strokes from medial to the stoma and then go distal, and I want to change my swabs each time because I don't want the secretions to go into the stoma. So I do that all the way around with new swabs, and I clean the base to get all the secretions off. Looks good. If I want to wipe off some more secretions that the swab didn't get, I will use a gauze. Okay. Now I want to dry. And I'm just checking out the stoma to see if it's inflamed or red. Pat it dry. You doing okay, Blink? Yes. Okay, now I'm going to put on the dressing. Carefully as not to move the trachea tube. I want to keep it stable. And I want to make sure that the gauze is flat against the skin. And I want to go under the smaller tube. Okay, now that's flat against the skin. Okay. Now, I want to put on the strap to hold the trach in place. I am leaving the old one on so that it's kept stabilized. Okay, make sure those are flat against the skin. And I want to tie it. And I want to make sure that I can fit 1 to 2 fingers underneath and that it's not tied on the carotid artery. That's good. If those straps are too long, I want to cut them so they don't get in the way. Just the strap, and now take off the old one. Put the mask back on, the trach mask. And now I want to clean up my stuff. Do hand hygiene. And I check his vitals on the machine. His oxygen is good. I want to make sure that the machine goes back to original oxygen. And then I do my respiratory assessment on him to see the lung sounds and everything. That's it.